So let's shift gears a little bit and talk about traumatic brain injury. The most common causes: a blow or jolt to the head, head injuries, gunshots, especially shaking, shaken baby syndrome. I remember some students said they have a client at Carolina Pediatrics that was a victim of child abuse that had a traumatic brain injury as a result of that. So of course that is going to affect people's cognition, language, memory, information processing, their motor abilities, depending on the extent of damage, their attention span. So all these things can be affected. So over 1 million new cases per year, 50,000 deaths, and then 85,000 people are left with a long-term disability. And you can see falls. So, falls can be very serious. Motor vehicle accidents, sports, all the data about concussions now, that the repetitive trauma from concussions, and of course, obviously, military war blasts. The riskiest ages are people, children for child abuse, accidents, 15 to 19. Yeah, young adults, again, accidents, leading cause. If you remember way back from Health 300, accidental injuries, number one cause of death and disability. And persons 75 plus, that's going to be more falls. But 10 to 20% of Iraq veterans have experienced a traumatic brain injury. And so it's almost a third of admissions to Walter Reed Hospital in DC. So what really happens, directly beneath the brain and opposite. So when you think about that with concussion, so you get an acceleration and a deceleration. So that what causes the damage. So the brain is moving about within the skull. And then what happens from there is a secondary damage occurs with edema and swelling that affects the tissue. So that's what causes the brain to slow down and reduce the metabolic processes, reduces blood flow to the brain. So it's really important that when an athlete, say, has concussions, repetitive concussions, they're pulled out of the game, they cannot go back in, because if they get a second concussion, it could be fatal. So, of course, it leads to loss of independence, behavioral issues, cognitive disturbances. You've seen this with some of the former NFL players: depression, agitation, confusion. Anybody who's experienced a traumatic brain injury is probably going to have major changes in their emotional and personality. Exercise testing. So treadmill if they can, cycle ergometer if they can. You can see this NuStep, which is sort of a semi-recumbent stepper. You can use an arm ergometer if they don't have the ability to balance themselves. So very low intensities, cycling 50 RPM, small increments and improvements, small progression. And you might need to use some assistive devices to help with their balance and their grip. And we'll talk about this more in the next class on spinal cord injuries. So using some things as hooks and bands and straps to help them get a good grip. So if this woman had weakness, say, on her left side, we might be able to use some sort of strap to help her hang on to that left side of the arm crank on the NuStep. And you may need to check their ECG and blood pressure monitoring, because they may have difficulty with with monitoring their blood pressure as a result of their injury. They may have had some trauma, and they could be prone to arrhythmias.